So with the AMT bridle system, we have two options to choose from. This one is the AMT standard. It uses umbilical tape. Pros to this would be that the tape ties more securely. Negatives would be that it's harder to keep clean because obviously it's an absorbent material. This blue probe is going to be the same in either kit. Same size, there's no differences. The other option is the Bridle Pro. It is a hollow tube, more difficult to tie initially and to possibly keep tied, but because it's rubber, it's much easier to keep clean for parents. So most of our patients will have this one. Things we'll notice is that we have in the package, we'll have the blue probe, we'll have the actual bridle, and it has a stylet included. This is removable, and noting that there are marks where we know how far we're going in. Those marks correspond on both of the tubes to about the same spot. These work really well for placement in adults. They're not so great for our smaller pediatric patients. So here's how we insert. So you want to do one at a time, because if you do them at the same time, then they just quickly hook to each other. So you want to insert the blue probe first, then the other one. You will feel and maybe hear the click where they meet behind the vomer bone. This will work better if your patient's supine. Of course, it can be done in any position if they need it that way. Once you hear the click, you will pull out the stylet, and then you will use the probe to gently pull around the bridle. So it's quite a length to pull through. You have to get it to where you have the clip in place. This clip happens to be closed, so we're going to use the little pick to open it. Inside of this clip is where the tube will sit, so you want to adjust it so that there's some room between their nose, but you don't want it to be hanging in their lip. After you put in the tube, you'll click it closed. You'll tie 1 to 2 simple knots below the tube. That's where you'll cut. And that section can be taped to the side with the tube, but there won't be that there. There'll only be that little bit of tube. To remove the tube, all you have to do is cut the one on the side opposite of the clip, and then it pulls out easily. If you're going to leave the tube in place and just change the bridle, have someone extra to make sure you hold the tube in place so that it doesn't get removed. Pick, and it's really just any like thin plastic to open these. We generally don't send these home with parents because we don't want to give them any extra tools to mess with these. And that's your bridle system.